Vaginal odor is a common concern for many women, and while diet can play a role, it's not the primary factor. The vagina has a natural balance of bacteria, and an abnormal odor can sometimes be a sign of an underlying health condition. Here are some things to keep in mind. Hygiene. Proper hygiene is essential for maintaining a healthy vaginal environment. Wash the vulva, the external area around the vagina, with warm water and a gentle soap. Avoid douching or using scented products, as these can disrupt the natural pH balance. Diet. While diet can't eliminate vaginal odor, eating a healthy diet rich in fruits, vegetables, and whole grains can support overall vaginal health. Probiotic-rich foods like yogurt may also help balance the vaginal flora. Underlying conditions. If vaginal odor persists despite good hygiene and diet, it's important to see a doctor to rule out any underlying medical conditions, such as bacterial vaginosis or yeast infection. Here are some specific foods that may help maintain vaginal health. Cranberries. Cranberries are acidic and may help prevent bacterial growth. Yogurt. Yogurt contains probiotics, which can help balance the vaginal flora. Garlic. Garlic has antibacterial properties and may help reduce vaginal odor. Pineapple. Pineapple contains bromelain, an enzyme that may help break down mucus and reduce inflammation. Please note that these foods may not be effective for everyone, and it's important to see a doctor if you have any concerns about vaginal odor. Here are some additional tips for maintaining vaginal health. Wear loose-fitting, cotton underwear. Avoid tight clothing that can trap moisture. Change your underwear daily. Wipe from front to back after using the toilet. Avoid scented soaps and feminine hygiene products. Women regularly use intimate hygiene products as part of their daily cleansing routine. Currently, there are many different intimate feminine hygiene products that may be used for cleanliness and/or odor control, but some can alter the normal pH levels microbiota needed for protection against infection. Although there is much published literature on the internal vaginal environment, there is relatively limited information related to the external vulva and how intimate personal hygiene practices can affect it. There is little published in the medical literature about intimate feminine hygiene as it relates to external topical washes and the role intimate feminine hygiene plays in managing unpleasant symptoms and supporting overall intimate health. Physiology of the vulvovaginal area. The vulva is the first line of defense to protect the genital tract from infection. Although knowledge about the microbial composition of the external vulva area is in its infancy, maintenance of the microbiota ratio is anticipated to play a key role in overall vulvovaginal health. The normal vaginal flora, acidic vaginal pH, and vaginal discharge are all components of the innate defense mechanisms that protect against vulvovaginal infections. Vulvovaginal infections. Many factors, such as immune deficiency, hormonal changes, stress, or use of a vaginal douche or soap to clean the vagina, may upset the normal flora and cause infections. Intimate feminine hygiene. The topic of intimate feminine hygiene has not received enough attention in the medical literature, thus making education a priority. Differences in feminine hygiene practices are related to differences in cultural beliefs and religious practices. Although common sense dictates that good feminine hygiene is desirable and healthy, no systematic trials have evaluated the health impact of vulva hygiene. Since harsh soaps may irritate the vulva skin and mucous membranes and provoke or exacerbate vulvar dermatitis, feminine wash products should be formulated and tested specifically for the vulva area to ensure that they do not cause skin irritation or sensitization. Appropriate female intimate hygiene using properly designed and tested products with key attributes including hypoallergenic, soap-free, pH-friendly, mild cleanser, no irritants, protection against dryness, and maintenance of balanced microflora is important. Taken together, these data demonstrate the importance of appropriate female intimate hygiene using properly designed and tested products with key attributes including hypoallergenic, soap-free, pH-friendly, mild cleanser, no irritants, protection against dryness, and maintenance of balanced microflora. In many cases, proper intimate feminine hygiene can help prevent or relieve the troublesome symptoms of itching and abnormal vaginal discharge, and improve overall well-being. Women regularly use intimate hygiene products as part of their daily cleansing routine. Currently, there are many different intimate feminine hygiene products that may be used for cleanliness and/or odor control, but some can alter the normal pH levels microbiota needed for protection against infection. Although there is much published literature on the internal vaginal environment, there is relatively limited information related to the external vulva and how intimate personal hygiene practices can affect it. Thus, education about the importance of, and potential risks associated with, female intimate hygiene is an important priority for both healthcare professionals and women to advance overall intimate health and hygiene. Gentle vulva cleansing is desirable, and evidence suggests that it is an important aspect of female intimate hygiene and overall vulvovaginal health. Because of the risks associated with internal washing or douching, external feminine washes are considered more appropriate for intimate health, particularly those containing lactic acid, with an acidic pH that augments skin homeostasis, and may serve as a helpful adjunct therapy in women with vaginal infections or taking antibiotics. Vulva cleansing may be a useful adjunct for women with odorous vaginal discharge, and daily use of a feminine wash may reduce the risk of recurrence of bacterial vaginosis. In addition, clinical practice guidelines recommend women to use a pH-balanced hypoallergenic cleansing agent for daily vulva cleansing. These external washes need to be carefully formulated for mild, gentle cleansing without impacting the natural flora, particularly in cultures where women may use these products frequently. It is also important for intimate feminine hygiene products to be assessed clinically to ensure that they are well tolerated and provide targeted antimicrobial and other health benefits without negatively impacting the natural vulvovaginal microbiota.